1 in 10 women have polycystic ovarian syndrome, but most don't know they have it. The sign addition all over your body. You have been treating some of these symptoms with things and products and supplements when the real problem is hormonal. Polycystic ovarian syndrome isn't just a problem with your ovum, it is your entire body responding to two major issues. One, insulin resistance will result in the high male hormone known as the testosterone. The elevated level of insulin and elevated level of testosterone is the root cause of this problem. Your cells stop responding to insulin properly, so your body makes more of it. And that excess insulin tells your ovaries to pump high amount of testosterone. The high testosterone changes your skin and hair in a very specific way. These are 6 signs that I can tell if you have polycystic ovarian syndrome. Number 1, the dark, coiled hair on your feet, chest, and the cheek. This is called hirsutism. I'm talking about thick, dark hair that keeps growing back no matter how much you work or sheet. This happens because the excess testosterone activates the hair follicle in places where women typically don't grow time length hair. That hair itself isn't the disease. It is a visible sense of what is happening with your hormone. Number 2, acne. You have tried every cream and nothing works because cream don't fix the hormonal problem. The high level of testosterone makes your oil glands produce a lot of sebum. And also this excess oil that is produced, it clogs the pores and then bacteria proliferate within the gland and then subsequently resulting into acne. And see, these acne are more commonly seen on the face, on the chest, and on the back. This acne is usually stubborn because root cause is usually the excess level of testosterone. Number 3, thinning of hair on your scalp. One of the cruel things with polycystic ovarian syndrome, you keep growing hair where you don't want it, and you keep losing hair where you need it. For example, you can see that hair on your scalp will keep extending to see, while hair on your chins will continue to grow. You will notice your hair growing wider and thinner around your forehead. This is what we call androgenic alopecia, which is common with the male hair pattern. This testosterone causes this hair traction and also increases the levels of hair on your cheeks where you don't like it. Number 4, the dark velvety patches on your skin, armpit, and under your breast. This is what we call acanthosis nigricans. The patients often tell you they have been scrubbing the area, thinking it's dirt. It is not, and we can't wash it off. This happens when a high level of insulin triggers your skin cells to multiply faster than normal. The good news is that if you can be able to control the level of the insulin, these factors will fade away. They are not usually permanent. Another thing that can point out poor polycystic ovarian syndrome is skin tags. These little splash-like bumps they usually occur in your neck, on the armpit. They are annoying but usually harmless. Skin tags are another visible marker of insulin resistance. They cluster around the areas of the skin where the scalp rubs together. Many who have lost sugar, reducing the level of insulin reduces this skin tag. Another important thing that we look at is obesity. Up to 8 out of 10 women with polycystic ovarian syndrome are either overweight or obese. The pattern of the obesity is characterized as what we call centralized obesity or the android fat distribution. In this case, the excess fat becomes concentrated in the upper body, usually around your belly, around the internal organ. And this is one of the markers that increases the risk of heart disease, type 2 diabetes, and other risk factors of chronic illness. If you recognize yourself with 2 or more of these things, you will need to talk to your doctor about polycystic ovarian syndrome. You should know that you are not fighting a separate problem. You are dealing with underlying hormonal issue that is affecting systems of your body. Treating the symptoms individually will not work. You have to address the root cause of the problem, which is the insulin resistance. That means lifestyle modification and some cases medication. If this helps you understand polycystic ovarian syndrome, share with someone who needs to feed it. Thank you.